Making a migraine treatment plan. More importantly, making a toolbox. But what does that mean? We're gonna find out. I'm Caitlin. I work at Jefferson Headache Center and Headache Disorders. I started working in the outpatient center 5 years ago. Before that, I worked at the inpatient center. And of our amazing physicians at our center, practice in the migraine space a good amount of time.
We're not getting movement. Bunch of people in between us.
So, I suspect everybody has migraine. Very close to someone with migraine. So the things we're not going to talk about, in particular, one of them is a diagnosis. There is no test to diagnose migraine. And they usually work that, certain recreation and going on. However, it's pretty straightforward. I think there's a tendency for people to not want to have some things. And I'd like to encourage you not to think that way, accept the diagnosis or other conditions you use migraine treatment. That we can talk about the toolbox to get control of your condition. Calendars can be useful. They can also be harmful. They can be people can sort of over fixate and over concentrate on this. And that's kind of what's going on with this. And triggers have been a little bit overplayed. They're effectively has something better.
So working as a try to get, I don't know if he's trying to get things to keep on this.
All the trigger work and figuring out triggers and cutting things out of your life, doesn't want harm you, but if it's a trigger, it'll probably be obvious. And if it's not obvious, don't worry about it. I know your life's like, and whatever you can, not sure away without the need to make probably worse. Yeah, well.
Migraine plus. We can talk about many things. And like Dr. Youngman said, a lot of things can contribute to migraine. So we want to fix all the plus that we can. What does that mean? Medication. There's a thing called rebound. Now it's called medication for headache. How many days are you taking medication? I know it's hard. You want to take medication, feel better. But if it's more than 15 days a month, you really need help to look at what's going on, coming up with a different plan. If there's something other inflammatory going on, like rheumatoid arthritis, can you help and get treatment for that? Many amazing medications that help rheumatoid arthritis actually can also help migraine. Thinking about other pain, especially closer to the neck, our jaw. Could you go to the dentist or clenching at night with a lot of jaw pain? Maybe they give you a mouth guard. Make a huge difference in helping them your pain. Neck pain, physical therapy is amazing. What else can you do looking at your pain? Maybe some topical gels. All these things contribute to our whole thing. Treating anxiety and depression, a lot of it goes hand in hand with migraine. And as people speak about here today, a lot of medications that can help migraine also help that depression. I know it's hard to be honest with the one.
Signal one.
Telling them, I am really anxious. I don't know if it's a migraine, or even before. If there's something I can help you with, or give you a referral, to someone who can help you. Weight loss, issues, gentle movement, help. Losing weight can definitely help in a lot of areas, especially specific migraine disorders. And sleep, I won't touch much on it, we're gonna hear a whole presentation. But what can we fix in terms of sleep? You're only sleeping a few hours a night. It's probably not gonna help migraine too much. Do you sleep apnea? Do you send you to sleep for a little and see if there's something else going on that can really help migraine? So in terms of migraine plus, are there other things that you're contributing that can make migraine worse? And how can we fix them? Those are all tools that you can use in your toolbox.
Next slide. So one way to think about the big picture of having a migraine toolbox is to think about it in this, there are things we can do with medication. And generally they sort out into avoidance medications and preventive. And then there's things you want to do with your mind and with your body. Now, for most people who are not in this room, they may only need the first two boxes on top. But they don't need the rest of it. If you have chronic motivation, even if you don't, just want to be good to yourself in a more holistic way, thinking about your mind, anxiety, depression, thought patterns, and counterproductive, and your body. Are you moving enough? Are you doing your? Are you addressing your job? Exercise, improvement, and health. Diseases and manage it. Whatever you do, they fits with your lifestyle and with the place you're in, you do that now. So, don't just spend what element you pointed out. Try to take a more complete and holistic look at your life. And that's all.
In our toolbox, as everyone has said. Next slide, please. In our toolbox, like Dr. Jefferson said, it's great to have many things other than medication. So what does that mean? We're always told to hydrate. Focusing on even a little more water each day can make a huge difference. Buy a fancy cup, make it fun, maybe get a purple one. If you think of option migraine, and really focus on drinking more and then celebrating that. It sounds silly. I do it myself, but wow, I actually drank all my water today. That's a huge accomplishment. In terms of a migraine safe movement routine, I have videos online, yoga and Tai Chi that are safe for a migraine. As the most famous Dr. Young says, movement is medicine. And this is another thing. You don't have to go out and run 5 miles a day. You try to walk 5 minutes. I know we're getting to the high, going out early in the morning. The light's not bright, it's not too hot. Like, incorporating that, setting the goal, 16 minutes for the whole week of exercise. You don't have to do 60 minutes all at once. If you want to and celebrate that, that's amazing. Maybe 5-minute chunks, 10 minutes. It all adds up. And then hopefully it happens to me. And in terms of connecting with people, taking people walk or the front. Get another person who has my support person with you. Self-awareness, relaxation. What does that mean to you? You all talk about meditation and the benefit of it. It is amazing. People cannot live forever. There's so much out there. Dr. Migraine also has a lot of medication suites available. But if that's not for you, it's your comfort. You get a fun color book. If they're not, that's also relaxed. What works for you? That's the most important thing. And I'm talking about your toolbox. My toolbox is very different than even Dr. Young's. And maybe Shirley's and the person next to you. Just because it works for him, for her, it don't work for you. It's great to learn from others. Don't get fixated on that works for them. That's amazing. Celebrate that for them. Also, figure out what works for you. Always give something a couple times. Want to try meditation? Give it 3 times. If it's not working, let's try coloring, walking, movement. Personally, I'm feeling super inspired by Deborah, who talked about her advocacy journey and what that did for her. Advocacy. There are so many support groups, especially the College for Migraine. They are amazing, and they actually have ones for working adults. Team talks, a group just for men. There's a lot of times and different availability that can work for you. And guess what? You can attend online, at home, in your bed with your migraine machines on, your ice pack, all day. They would love to see them. They might be like, where'd you get that ice pack from? I'd love to buy one myself.
I'm not listening.
So again, the toolbox,
Through the streams.
it's gonna look different for everyone. And really, like Dr. Gunn said, accepting you have migraine. How can we see setbacks as a learning opportunity? I know it's so hard on the hard days. But where can we learn and grow from? And also celebrating, wow, I took my medication early, and that made a big difference. Or I went for a walk 5 times last week, it didn't happen this week, but maybe this week I'll go out and keep reading. Celebrating that. Keep a little journal. I think this might sound silly, but I have sticky notes on my mirror in front of me, little quotes or different things that I look forward to doing each day, or little goals. And celebrate them. They all add up, especially in their 2 months. But I want to take away again, what works for you, the person next to you might not work for you. So really, just give yourself grace. This is where it becomes customized. Next slide.
No.
This turns out to be a very important, unfortunate part of migraine learning. There are actually ways you can compare stigma. And among the chronic, non-infectious diseases, and migraine is the most stigmatized of these diseases. It's in the bottom third of the, compared with the bottom third of the psychiatric diseases, it's about halfway of sexually transmitted in terms of being stigmatized by society. So this is real. And it manifests in several ways. It manifests in all those little sort of nasty things you hear, these messages you get, from people who say, oh, I take a Tylenol and that works for me. Or vitamin for your feet and hot water, or something like that. But that nonsense. The journey that you're on. It manifests in people who don't understand that this is a mistake. Disease. You may not be able to do things the way it's like. That's a part of the disease, but it's that. And all of these little microaggressions occur constantly. People with migraine and even more constantly with chronic. And then there's all those structural. There is no category for migraine in people's thinking, in the laws and the rules and the regulations, policy. If people don't want to be able to people pathway, the way to deal with their problem. They want to tell us that it's not that important and that it doesn't deserve, accommodations, law, and regulation. Definitely, the way to get disability is your migraine at that. So over time, these interpersonal and structural stigmas inevitably affect the way a person who's chronic migraine thinks about themselves. So this is the the process of developing self-stigma, which is the inevitable consequence of facing these interpersonal, these microaggressions, these structural aggressions. And people develop low self-esteem, depression, and anxiety. It contributes to having more pain. It leads to concealment of the disease, which is sort of very natural. We don't want to, be subject to the stigmatizing attitudes. Learn not to seek treatment. Because it turns out that when a physician or a healthcare provider stigmatizes you, it just breaks the worse. And if the person at the store does, and unfortunately, you get that from provider. It leads to people who are presenteeism, who just stick around and don't function well just because, they'll get more stigma if they don't stick around. It's a low participation in activities because you might end up, having to disclose that you've so I don't want to have this and we just open this. So all of these ways, people, the cells, and cell, initially all of Fine. So what can you do? One of them is to tell their story well. One way is to tell your story with knowledge. You need to craft your decision. And I would recommend that you think about this and you do it, but you do it with caution. Can you find a qualified to tell your stories? And you want to tell it in a way that shows your strength as well as your weakness or inability to do certain things. You need to show that you are mastering your situation, that you have a chronic disease, you're managing with grace and with dignity. But you do have to tell your story. Use the right language. The Coalition for Headache and Migraine Patients chat has a language and image guide. And these are ways that people talk that the migraine community has decided leads to less stigma. I'll give you some examples. Try not to say migraines. When you say migraines, it emphasizes the attack, occasional attack. It leaves the impression that it's just a sometimes thing. No, this is a chronic disease. You have migraine disease. That's a better way to do it. You don't say asthma, you say asthma. And then when you want to talk about the asthma attack, you talk about that. That's just an example. Use the word disease. It is a disease. There are changes that are going on in the brain with migraine. And it affects function of organs. That's what the disease is. So those are just examples. But I do recommend you look at the chat language and image guide. Be seen. But as I mentioned, do it well and seek advice about how to do this well. When you need accommodations, insist on them. And you can find many organizations have lists of possible work accommodations, open accommodations. Look at the list. I recommend to my patients that they pick out the ones that are most valuable. You can find a list with 50 accommodations for people with migraine. Prioritize what we want. And when we're speaking to an employer, your family. You think about how it might impact them and find an accommodation between the two, your needs and the employer, let's say. But do see the accommodation. We work well, to perform well, and to have a satisfying work experience. Support others with a disease. Nothing is as helpful to yourself as helping other people. And participate in the movement. The only way for things to change, is to address the disease head on. If you think about some diseases that in our lifetimes have made an enormous impact at reducing stigma of illness, let me give some examples. Autism is a good example. Breast cancer. These things used to be heavily stigmatized, and the community came together and they decided that this was unacceptable. And together they changed the world. And because of that, there's more research, there's more acceptance. There are pathways that people can get the help that they need that don't exist stigmatized diseases like migraine. Next one.
We're gonna talk about. As needed medication. What's the general principles? I know this is so important, I'm talking about customizing things, but it's a tailored treatment. To you and your intent. Again, might need someone today, find out medication works amazing for them. Might not be the best medication for you. And for what you do. Then we weren't gonna talk about triggers too much, but if you have specific triggers. Trying to see how you can avoid them, mitigate them, have some shades up there, there's different. Light devices we're gonna talk about later. How can we reduce them? Treating early, this is so important. When you treat early, you can really help the attack, not hopefully get worse. And I know it's hard. Sometimes you're holding on to that net, but the pieces towards the attack and bone you have.
Best I can do.
Please talk to your provider, but treating early can definitely make such a huge
I think
difference.
it's a lot of difference between us.
Bypassing the stomach. I don't feel any may know. Migraine is associated with nausea and vomiting. So what does bypassing the stomach mean? Maybe oral medication is not the best nausea. If your attacks with vomiting very soon after. It might not be the best option for you. But again, what does that mean? There are nasal sprays available, some injection for muscular, even ones such as all on your tongue. And also migraine is related to the slow gut. What does that mean? Slow gut. Do I have it? The oral medicine aren't gonna work as fast. You're gonna keep on them. Mine and the gut are super connected. So when we can bypass something before it's too late. Before you're in the bathroom. Let's use it. And I know that's not always easy. There's certain occupations where you're out and you don't want to be using your nasal spray, giving yourself an injection. But let's talk about it and try to get you here. And that's also treating early. If you treat early, you can use your oral medication. I love non-medication options too. Sometimes by themselves, or sometimes in combination with medication. There are amazing ice caps that are available. They can make a huge difference. Some full of heat, I love heat too. Relaxing, like I said earlier, coloring. To distract you, therapeutic. Meditation. Very amazing resources online, but even just a body, just taking a minute. Giving yourself grace too. And crying, like we said, we have the cry from today. I know that's not always available, but when it is, try and use it. And a beautiful garden room, Medication. I know it's so hard. We want you to use your medications. We want you to use them early. But then we tell you to not over. This is working with your provider and hopefully giving them as much information as possible to help you. Maybe we can help you pick a better first option that might work best. Or not work. What might be the best option? Or what type of? It takes some time. Every plan is custom. Again, what may work best for me might not work for the person next to you. You may want to come up with a custom toolbox. Hope we're all walking out like, oh, I am a full toolbox I'm coming out with. And it's going to be different than the person. So using medication with a certain word can make a huge difference. I know we said we're going to talk about calendars. This is where I believe a calendar comes into a play. I have patients all the time, bring in a calendar or just what they're taking in when. Maybe all I have to do is tweak something, just a tiny bit. Maybe if you try this first, or we add something else in, your plan would work better. Maybe on day 3 of this, I would have maybe went for this medication. So using a calendar in that way to show your provider what's going on at home. They're not with you every day. And we might only be seeing you maybe once every 3 to 6 months. So providing us information helps show us what's going on. Next one.
So one way to think about the acute medications is there are the non-specific ones which work for other conditions, and specific ones which are only there for one. So the non-specific meds include the non-steroidals, Advil, combination analgesics like Excedrin. Puricet is also, which is butalbital, is also there in that category. Nausea tests, not a lot of noise. Even older. Like the dance with eating older. They work for migraine. They don't just treat nausea. They treat the pain of migraine. People sometimes forget that. And they don't want to take their.
Hey, that's wrong. Use the metoclopramide or the prochlorperazine, the Reglan or the compazine for the migraine headache and the other symptoms of migraine, even if there isn't any nausea. It makes a big difference. The corticosteroids can be helpful, and opioids can help, but one needs to be very, very careful not to overuse them. And, there's no way to stigmatize yourself to more than to be using opiates, unfortunately. Then there are the specific migraine medicines, the ones that are designed to treat migraine, like DHE and ergotamine, like the triptans, sumatriptan, rizatriptan, and there are 5 other triptans, like the GPANs, which are Nurtec and Ubrelvy and Zavspret, and the Ditans, which is Rayvow. So those are designed for migraine, and they'll need prescriptions, but chances are one of these can help you. Next slide.
Your backup plan, so important. I think it's so empowering when someone knows when this doesn't work, what do I do next? I know that anxiety of fear, like, well, if I take this and it doesn't work, what do I do? I need a backup plan. So having your meds that you know are your go-tos. They work well, but what happens when they don't work? Having that next medication option, and for you not to think about it. Most of us, when we have migraine, we're definitely not in our best space. We're feeling foggy. What do I take? What do I take? What do I take? I don't remember. Let's also give ourselves clues right on the bottle. Highlight it if it's the backup plan. Sticky notes. This is where your little custom toolbox, even having a section in your house. Oh, this is the next step. I'm not feeling great. This did not work. This is my next backup plan. And it all depends on what's going on. Maybe you're like, it's not my worst migraine, but I have a lot to do today. I have to go to work. I'm looking forward to an event like today, and I really want to go. How does it help you get through what you want to do? So backup therapies are amazing. Working with your provider to say, hey, sometimes this does not work. What would I do next? This works 9 out of 10 times, but when it doesn't work, or it's an attack that's stronger and not getting better, what do I do? I really think it really relieves a lot of anxiety knowing what's coming next and having that backup plan. And again, make it easy for yourself. When you're not in an attack, set yourself up with a space in your house. Highlight, star it, whatever works for you. And also, if you can, have it available in your pocket, your car, make sure it's safely stored. But have it available to you to take, because that's important too. All this medication or devices that we will talk about later, they're great, but if they're not with you, they're also not helping you. Next slide. Oh, is it working?
Next slide. So here's how I like to think about, using all the tools available to treat your migraine attack. So notice that among these in this table, we don't have the butalbital, which is Furoset, and we don't have opioids. Those are, things that I think should very rarely be used because they're so prone to causing rebound and because they're controlled substances. So in the first category are triptans and ergots. So those include the 7 triptans. Some are oral, a couple of all are oral, a couple are nasal sprays, one is injectable. Then there's dihydroergotamine, which is a really good and underutilized migraine abortive that's available. Unfortunately, it doesn't get absorbed orally. So it's useless to take it as a pill. That doesn't exist. So there's nasal spray, there's injectable, and we'll talk a little bit more about that later on. And then lasmiditan is very similar in the way it works, but is safe for the heart. And people who have heart disease, it's a good choice for them. It's really a little bit more effective, but does have some side effects that people have to manage if they use it. The non-steroidal medications, and I'm going to throw Tylenol in here, are really valuable, and we forget how good they are. But, Advil can be very beneficial. And sometimes people just forget that, like, that used to help me, and maybe it'll help me now. One does think about the longer acting ones and the shorter, faster ones that might be more effective in the moment, but maybe the benefit doesn't last quite as long. There are combinations that include Excedrin, which has acetaminophen and caffeine, as well as aspirin. So we should not forget about those. There are the dopamine, the nausea medicines, and I listed some of them. They're often, we often see their brand names, even though they're very old, because their brand names are so extremely difficult to read and pronounce. But Compazine, Reglan, Phenergan, Thorazine, and Zyprexa can be very effective migraine medicines. And then more recently, the 3 GPANTs. Now, one generally does not use something in the same column in the same day. So you don't take DHE today, and then if it doesn't work, you take sumatriptan or vice versa. That may not be safe. So, don't use that. But you can take sumatriptan and a nonsteroidal, and that's fine. That often, is additive and working well together. The same with the dopamine, the nausea medicines. And honestly, while the meds are newer, it seems to be the same with the G-PANTs, with the Ubrelvy, Nurtec, and Zavspret. So, if you need one medicine, it works, that's great. But sometimes you need to have a plan where you actually take them simultaneously. And there is a new product coming to market, which sort of takes advantage of that concept, which we'll talk about later. So in your plan, you may have things from several columns here, or you may have a plan to take one from column A and one from column C, for example, and take them simultaneously. But think about the plan. It shouldn't be haphazard. It should be a little bit thought out. And I think you'll find better results if it's treated that way. Next slide.
So recent available medication, Trudesa, they are actually here with us today. So you can walk over later and see the device yourself. It's a DHE nasal spray. And like I talked about earlier, bypassing the stomach. This is a great medication. And actually how the device looks, you can see it over there. You might be like, what is different about this device? Actually, how it hits your nasal passages can help it get absorbed better, making it work faster. So Trudesa is an amazing a medication that's available now. So talking to your provider, is that a good option for yourself? Symbravo, I believe I'm pronouncing that right, not available yet. But like Dr. Young just said, when we can mix and match, this actually 2 medications in one, meloxicam and rizatriptan. This is going to be rapidly absorbed, and they're going to help each other. They're going to help each other to work better and work faster. And also, it's great. Now you don't have multiple med bottles that you're carrying around. You have them one medication that works. And Brieka, I believe I said that right. They're here today. I am so excited about this, a DHE auto injector that's coming out. For those who have used DHE in the intramuscular way, that ampule is not migraine friendly when you need to use it. So having an auto injector with DHE is going to be amazing. And that should be available later this year. Next slide.
So let's talk about rebound headache. So we don't like the term medication overuse headache. That's the only time I'm going to use that ugly term because it's stigmatizing. It tends to blame the person who's rebounding. So rebound is when taking abortives too often changes the underlying pattern of migraine in a negative way. So you may get an excellent result in the moment, taking a triptan, but over time, you have to take it more often. And then over time, it gets rid of your migraine attack, except it leaves a little bit of a tail, a residual low-grade headache. And then you keep using it because it's getting rid of the spikes of migraine. And that low-grade headache gets worse, and it's no longer trivial, it's bad, just not as bad as the attack, so you keep using more. And over time, some people, actually find they have to use it at the same time of day, where, predictably, they're going to need to take their sumatriptan, in the morning because that your headache always escalates in the morning and then you have to take it again at night. And gradually over time, disease is getting worse and worse. That's rebound. So what can cause rebound? And this is the really bad stuff are the opioids and the butalbital. That's why headache doctors are going to be really cautious when they prescribe that. That's not necessarily, doesn't necessarily mean that you should never take them. But honestly, I want my patients to use less than 4 doses per month or less than 4 days per month for those, or they could get into rebound. And then there are things that aren't quite so bad. Triptans, sometimes they can lead to rebound pretty quickly, and sometimes you can swim along for 20 years and then, the situation worsens a bit and you will evolve into rebound headache. But they're also generally this rebound is a little bit easier to manage. We think that the nonsteroidals can, Excedrin, others can cause rebound, and they need to be limited to less than half the days of the month. It's important to realize that. And if you look at your calendar or you look at your last month and you've used an abortive every single day, that's a problem. The good news, though, is that we don't think that the GPENs, that's Nurtec, Ubrelvy, and Zavspret, can cause rebound. So this has been, a very good thing for the field of headache medicine to have abortives where you don't have to worry about rebound. Thank you. So one of the ways to think about, migraine headache is, that it can get worse. It's a chronic disease, and sometimes it's a daily thing. And sometimes it's once in a while. But sometime around 1 headache a week, the prognosis of going into daily headache a year later gets worse. There's a higher chance of evolving and worsening into chronic migraine. And so it's around 4 days of headache per month that we want to think about preventives. We want to think about a little bit more carefully about strategies to keep the migraine disease from evolving and from worsening. Next slide.
I got the clicker now. So doc, what does that mean? You're telling me I shouldn't take my meds that often? Well, what can I do? This is when we can consider a preventative medication. So if migraine is making it so hard to work, affecting your relationships, just getting laundry done, we should think about prevention. How many attacks are you having? And what do those attacks mean to you? Well, I only have 4 attacks a month. Only? Does that take you out for a whole day and the next day you feel like you're recovering? And the day before you're actually having symptoms too? That's 12 days a month. That's a lot of time to be down. So talking about how many attacks you have and how long are you out? 1 hour? 8 hours? 3 days for 1 attack? We really need to consider prevention. And like we talked about overuse, if you're using a lot of your medications and you're running out monthly, we really should consider a preventive medication. Or maybe they just don't work for you right now. They may work for you in the future when you have a great prevention medication on board, but they might not work now. Or you can't take those medications. You have something else where you're like, I'm not allowed to take the NSAIDs or the triptans. So let's come up with a plan that's safe for you. And preference. Do you always want to rely on your medications? You're like, I have to have them. I got to pack them. Where do I keep them? I lost them. It might be easier just to take a daily medication or an injectable once a month. And especially, there are some scary attacks that look like you're having a stroke. And that can lead to, even if it's just once a month, does that affect your balance, your life? You can't talk, you can't perform. So please telling your provider what is happening in your life and how much that's affecting your life, because it really can make a huge difference to have a good preventive medication on board. So bridge, what does that mean? Maybe not the Walt Whitman that you took here. Bridge therapies can be very useful. This is a calendar of someone with chronic daily headache and where they're taking their meds and their pain severity. Those four, let's see, there's a clicker here. This at the top is when a bridge therapy was used, and you can see their pain finally came down in terms of severity. So the medications were maybe helping a little bit, but the pain just kept coming back and coming back. So there's medications that we can use in a certain way. And this, again, is very custom for everyone. Maybe taking a medication in a certain way a couple times a day, 3 days in a row, 5 days in a row. And depending on else is what's going on. Are you very nauseous? Do you have a lot of neck pain? And what's available to you and how much do you have of it? Because I know it's a bridge therapy can be amazing, but if you're like, that's going to take away 5 of my medications for the month and I'm not going to have any more left over, I don't really want to do that therapy plan and use all my meds and then feel anxious later in the month. So coming up with a plan in a combination of medications, that graph earlier with the medications, coming up with a safe plan to take a medication in a way for a couple of days to really get your pain down. And that's talking to your provider and where backup comes in. I love having the backup plan, saying when this doesn't work or I've used this 3 days in a row and it's not working or my pain's only getting slightly better, what do I do next? Because this is happening maybe once a month. Also, if that's happening quite often, that's when we consider prevention.
Now, some patients need an even stronger bridge, which is IV treatment. There are kind of 2 options or 2 places you can get the IV treatment. One is in an infusion center and one is inpatient hospitalization. Now, clearly the most effective is the inpatient hospitalization, but it takes a lot of resources. It takes a lot of time. You have to be out of work. You can't be with your kids. So infusion is an excellent option. And, really the inpatient should be, reserved for very severe and extreme circumstances. The infusion is less disruptive, less expensive, and needs less resources, less expert nurses, who can manage the medicines. In the inpatient, you can have, other comorbidities addressed. You can have a psychiatric assessment. You can educate yourself and your the inpatient team can educate you about tips to manage your disease after discharge. Next slide.
Preventive medication. We have so many medications now. It's so exciting. We have new ones out, new ones coming. Yes, take pictures, please. So this is also when we want to think about what kind of comorbidities you had. I said earlier, we should help with Migraine Plus, figuring out how we can help with those. Do you have high blood pressure? Even if you don't, those medications are amazing in those class. Is migraine really making you anxious to go to work or go to social events? Maybe we can give you a medication that helps address anxiety and migraine, helps also address your mood and migraine. Also, not being afraid of a seizure med. I don't have seizure. Why am I taking this? Some of these meds have been studied a long time. They've been used a long time. and they were very safe. And we've had a lot of experiencing them, and they honestly make a huge difference. Botox can be scary. Injections in my head, a toxin. It can be super effective, especially along with some of these other medications. And being honest, I'm never going to take a daily medication. It's just very hard with my lifestyle. Coming in the office every 3 months is easier. And so again, so many new medications, so exciting. We have the monthly injectables, we have the G-pants. Some of the vendors are here today. These medications have been a game changer, very limited, very few side effects, and super effective. And like I said, this is your custom plan. What may work next for the person next to you might not work for you right now. I think the biggest drive home is please give these medications time. I know that's hard. You've been most likely dealing with migraine for a long time. At least 3 months, sometimes longer, depending on the medication. Most of these won't work in 1 day or 1 week. So talking to your provider about when you should see results. And you might need to be on a combination of these for a while. Another take home, nothing is forever. Just because you're taking this medication now does not mean you might need to be taking it in 10 years. So sometimes we have to use these medications to help us get to a better place.
So there's a research going on with some upcoming medications. There's another little protein called PACAP, which seems to function in the nervous system similar to CGRP, which is how the GPANs and the monoclonal antibodies, the newer GPANs and monoclonal antibodies work. And there's a positive trial. So it's possible, maybe likely, that in a couple of years, we'll have another class that works differently and may be able to help people who aren't adequately helped by the GPANT-based medicines. There are several more botulinum toxins that are being studied for the treatment of migraine. There's a digital therapeutic approach that has been shown to be beneficial in migraine disease. And there's a new EMG-based biofeedback program and device, JOGO, which has been shown to be effective for episodic migraine. And so that will make muscle-based biofeedback more available to people with migraine disease. There are the natural preventives. So there are over-the-counter natural, I call them naturals. There's an herb called Petadolex. It's the root of the butterbur plant. It does matter how it's made. If you're going to use it, we are suggesting you stick to branded butterbur because we know it has the active ingredient and we know it does not have the possibility of having toxins in it. There's vitamin B2, there's magnesium. We recommend the glycinate or the malate, which are very rapidly absorbed compared to the other formulations. Feverfew can be helpful, but it has to be taken 3 times a day, which is a little inconvenient. Coenzyme Q can be very beneficial as a natural preventive for migraine. We recommend the lower doses of melatonin. So we're nowadays keeping more at the 3 milligram range for melatonin, and it, again, used nightly over a long period of time, not as a sleeping medicine, but as a migraine preventive. And then some people are benefiting from medical marijuana for the prevention of migraine.
What's your device? There's a lot of devices available for migraine. They all work a little differently, and I know money and cost is a factor. But what's super exciting now, Nerivio, which is this fun armband device, actually some insurances are picking up. Some are actually available without a prescription. You could go on during break and order them today. And that's the Hedaterm, Cephaly, and Truvaga. Let's see right there. But talking to your provider and looking these up, seeing that might work for me. And they're great options to have in your toolkit. Sometimes putting it on and still taking your medication, or putting it on and resting and then maybe going for your as needed medication. But they are really amazing, super effective. Some that can be used preventively, and some that actually are both for preventive and as needed. And again, I know cost is a huge issue, and some actually do money back guarantee programs. So that's amazing. You can try it, and if it does not work within a certain time frame, send it back and they will give you your money back.
And it turns out that light has an effect on migraine and migraine headache pain. And so there are some options that sort of take advantage of this. So the Allay lamp is the green light, and low intensity of green light can actually reduce pain more than going into a completely darkened room. So it's actually beneficial. And it's definitely better than other colors of light for many people with migraine. Blue light is the most exacerbating color for migraine, or for many people with migraine. And so there are these amber lenses that block out the blue light. And I would consider those. And then and those include Theraspecs. And then the Avalux is designed to block out blue light and some other other parts of the spectrum. And there may be some benefit to using that color as well. So think about these options. A great chance to not cure migraine, but to manage it better.
Okay, so you have migraine. How often? How bad? So we weren't going to talk about triggers, but are there any triggers? What can you manage? What do you need help with? What do you need help with? Your as needed medications? Do you need a preventive strategy? Talking to your provider and really telling them, I need help with this. We're not mind readers and we're not with you every day. So really helping us out and providing us with as much information really can go a long way. And advocacy, reducing stigma, so many ways to get out there, and a little goes a long way. I always say, you teach one person about migraine, where does that go? They go on to teach 5, 10 other people. Maybe someone's a lawmaker. They work in policy. They're actually a provider and they learn about it themselves. We're in a space where now there actually are commercials for medications for migraine. And someone's like, wow, an IV med for migraine? Not just Excedrin migraine? What does that mean? Oh, well, you know what? My friend Karen told me about this med she takes. She actually gets Botox. It really does change the thinking, and a little goes a long way. Creating a healthy lifestyle, even if it's just working on your hydration, getting a fun cup, moving a little more, and it doesn't have to be an hour of activity a day. Trying to get there is amazing, but also letting it build up. And using our plan, medications, devices, working out a plan that is custom to you. The takeaway, I do believe, still, I said it a lot today, is custom. What's your custom toolbox? Do you want to put even stickers on it to make it fun? What is in your toolbox and what works the best for you? And what may work best today might not be what's best in a year. You might need to even revisit something that you tried 5 years ago. Maybe now it's the best thing that's actually worked for you. So really coming up with a custom plan and helping your provider see what's the most important to you. If the most important is getting through the workday, how can we help you do that? Maybe it's wearing a device, and some of them, they're actually discreet. You might not even know you're wearing them. Thank you.